Welcome everybody. This is Real Talk, and this is a GenFit episode. So we're looking today a little bit about nutrition. We've got two specialists here. We've got Rosey Ahuja and we've got Michael Osei-Kisi, two specialists in the field of nutrition. Today we're going to be talking a little bit about diet. We'll be looking at fat and conditions that are related to that, and how the environment affects those type of things. So it's going to be a good episode. I hope you enjoy it. So without further ado, I'll introduce the two guests. So Rosey, can you tell people a little bit about yourself, where you've come from, what's your background, what you do?
Okay, hi everybody. So I am actually a psychology graduate, and I was teaching psychology for 20 years. And then looking at what else to do, I sort of ventured onto nutrition. The biggest driver for nutrition for me was that my daughter was 4. She felt very ill, just from school, caught norovirus, and she was then periodically being sick for a good 3 or 4 months after that. And I just thought, right, went to the pediatrician, nobody could find anything wrong with her. Then somebody sort of guided me to go to a herbalist. I went to a herbalist and he fixed her in basically one day. Wow. So after that much sort of issues and health issues, and then you just think it could be fixed in a day, and I was told that it was due to inflammation. I spoke to this herbalist. I said, where did you study? And that's how then I went to CNM, and that is the College of Naturopathic Medicine in Birmingham. And I started on this sort of 4-year nutritional diploma, and it's really changed my life. I hope it's changed my family's life as well, either willingly or unwillingly. It has changed everybody's life, because I felt that I needed to be empowered to help my family. I needed to be empowered to help myself, and I never actually realized the importance of nutrition in my life and in others' lives, and how it can be of support. So that's how I ended up with going on to be a nutritional therapist, which I've started practicing now, and I do thoroughly enjoy it.
Excellent. Thanks, Rosey. Just touching on something that you mentioned earlier there, in terms of, you mentioned about norovirus. Mm-hmm. What is that for the listeners?
Norovirus is just a virus which children get, and it's often in schools that they're picking this virus up. And most children, they're ill for a few days, and they might have the sickness bug, and they're exposed to so many things in schools. And I think the leading factor, or the leading reason why, one of the reasons actually that this is becoming more and more a problem, is because we're all so hygienic, and we've never thought about why hygiene is a problem. But hygiene, actually, because we become so clean, we can't actually deal with the bacteria that we're surrounded in. So if you want to get your kids healthy, you need to start getting them dirty as well. We need to throw away all of these wet wipes and and think, oh my god, we've got to clean everything. We all played outside with dirt, and we're all very healthy. And one of the reasons that they're saying that and there's becoming resistance to antibiotics as well, is because we're not exposed to all of these bacteria that actually we should be, which will help build our immune system.
Yeah, that's interesting. Yeah, just that like you said, we are kind of obsessed with keeping things clean, and the benefit of, kind of like you said, getting out. That's good. Great, thanks, Rosey. So Michael, tell us a little bit about yourself. What have you come from? What's your background? What do you do?
Yeah, thank you. Hi everyone. My name is Michael Kisi. My background is in medical imaging, diagnostic radiography. I practice in Ghana and also in the UK, and then later on, in course of my profession, I had opportunity of being introduced to 2 international organizations who are into nutrition. So I had opportunity of being invited to the organization, had further training with them, and then it started with that helped me to actually develop further interest in cellular nutrition. And then later on, along the line, I pursued a course in functional medicine. And most currently, I train also as a diabetes educator, and I am really enjoying what I've learned so far, and the impact it's making in my community. I've been helping different communities in churches and other community groups, to create that kind of awareness. I've joined also Diabetes UK as a community champion to help to spread the message about diabetes awareness, and it's also going very, very well. And so I'm really, really excited about this opportunity to be able to impact knowledge to people.
That's great. Thanks, Michael. And just kind of coming back to what you were saying, you said lots of long words there, which some people might not be aware of. So one of them that you mentioned, functional medicine, cellular nutrition. Could you just tell people a little bit about what that is?
Functional medicine is a very an integrated form of health culture that looks not only at diagnosing to treat symptoms approach. It's about identifying the root cause of a pathology and helping patients to, improve the outcomes of patients through lifestyle changes, exercise and stuff like that. So it's not about just taking medications, it's about identifying what is the root cause. For example, in functional medicine, you may have two people who have diabetes type 2. In diabetes type 2, you have either you give them the metformin or maybe or plus insulin, and whether you are in UK, US, Africa, wherever, the treatment pattern is almost about the same. But in functional medicine, we don't just go straight away to give you medication. We look at what has been the predisposing factor behind the diabetes type 2. Somebody developed type 2 because of wrong eating habits. Okay. Another person may develop diabetes because of stress and maybe high levels of toxicity, or maybe some medication the person was having in the past. So we look at the root cause behind what actually brought about the diabetes, and then we help the patient or the client to remove those underlying causes before we administer any medication of a sort. So it's all about helping people to identify the root cause of an issue more than just treating the symptoms of a disease.
Yeah, that's true, isn't it? You kind of comes under that like holistic approach, doesn't it? Yeah, so holistically looking at somebody in terms of, if you've got something, what's the root problem rather than just the symptoms.
And I think what's really interesting about functional medicine as well is that usually if you ever plot somebody's life and you plot what psychological events or traumas have occurred, you often see that there's been a physical trauma just after that. So when we look at the individual, we have to look at them holistically, because we are holistic. We're not just a physical body, and everything is that it goes back to dualism, isn't it? Like the mind and the body debate. So if the mind is connected to the body and the body is connected to the mind, both ways you have to work with the whole person to get to the root cause. And I'm totally agree with what you're saying in terms of like helping somebody, because you might find, like I've had clients in, and you always say, they'll come in and say, I've got irritable bowel, and first thing I say, well, what are you irritated about? What is causing your irritation? Because that something in their mind is causing the irritation, which then is linked to the bowel. The bowel isn't going to be irritated by itself, and then that might lead to inflammation. So you have to link at both. And I don't think we can ever, as nutritional therapists or healthcare practitioners, in any way ever divide all of those factors. I think you always need to look at the whole person and then help the whole person. And when you do functional medicine, you actually even look back preterm, even when they were in the womb, what happened? Was there a trauma in the womb? That is the cause of what might have happened later on. And I've got a friend of mine, and her daughter is unwell, and she believes it was because that when she was breastfeeding, she actually gave her toxic load onto her child without realizing, because obviously you don't realize your own toxicity as a mother. So but without awareness, I don't think we can actually help people. And I think that the most important thing as a nutritional therapist is actually education, and that I'm so passionate about that I think that it's important that we educate people. Obviously we want to support people, we want to help people, but when clients come into my clinic, I want them to be educated to make the right choices. And the amount of times I've heard, I didn't realise that, or oh my gosh, what I've been eating for so long, and there is so much misinformation. I mean, I don't know whether you want to talk about the fats debate, you know, like people have been conditioned to think, okay, fat's wrong, you never have any fat. Yet every single cell in our body needs fat.
Yeah.
You know, it needs the right fat, right? But it needs fat. So it's about eating the right things. It's not about saying, right, okay, this is wrong completely. You know, I mean, the sugar debate is one debate which we could talk about, but that would be a whole new talk by itself. But I think the fat issue is something that we definitely need to educate people.
Yeah, touching on that'd be great to get your opinions and your thoughts on this, Mike, because I know you specialize in metabolic pathways and in particular how insulin and carbohydrates affect the body. So what are the kind of the main causes of making people fat? Does fat make people fat, or is it other things?
Yeah, that's interesting. In fact, this is a very important question, honestly. The reason, the fact that's Rosey said, fats, you know, I think we have given fat a bad label over many, many years. You know, the conventional wisdom, for example, for like when it comes to weight loss, we are looking at, you know, stop the carbs and stop the, you know, like when you stop the fat because it's going to cause you to become fat. But it's a big misconception. I'll explain this way. You see, building fat development, building fat in your body is a metabolic issue, you know, which is linked to the hormones. When you take in, for example, when people consume carbohydrates, of, you know, the calories being acted upon by this hormone insulin. Okay, then insulin obviously will actually generate, work on the glucose. You know, when you take carbohydrate, it breaks down into glucose, and then it will compel the pancreas to release the hormone insulin. And insulin actually works on the body to actually send the sugar to the appropriate site, the muscles and the fat cells. But the point is this: the excess glucose may be stored in the liver as glycogen, you know, the storage, but it just the storage capacity is just limited. The rest of it is stored as fat, and that is being directed by insulin. So insulin, in this, apart from insulin, one of the major functions of insulin is a fat storage hormone. So when you consume carbohydrates, it's actually causing you to store more fat. Yeah.
Yes.
And I come back to the point again. Fat has a very important role because the human body, we are made up of trillions of cells. The cell membrane has a fat layer, and that's very important. It's been found out that through scientific research that if you compromise on your cell membrane, it may predispose somebody to premature death.
Wow.
And most of the hormones and the glands are made of fat. For example, as a man, you need the fat in your system. Otherwise, you lose your testosterone and all that kind of stuff. They are all fatty. Okay. So there's even the nerve system, the myelin sheath around the nerve is also fatty. Fat has a very important role to play. So we need fat to protect us, you know, in many things. Yes.
Great. So, all right. So we've established we need fat and we don't need excessive amounts of carbohydrates. So what would you kind of recommend? Let's say, I'm trying to decide how much of this I should eat, or how much. If I was to say, look at a plate of food, how much of that should be fat, and where am I going to get that from?
So actually with what I always say with fats, always think when you're looking at your plate, what is that food going to convert into? So as we were talking about carbohydrates turning into sugar, you still need a level of carbohydrates because you need it for your fiber, but you need complex carbohydrates. You don't need simple carbohydrates.
So just quickly, complex yeah,
are your vegetables essentially, which provide you with the fiber, and then your simple carbohydrates are your pastas, your breads, and I'm not saying, you know, for 1 minute that, you know, I'm 100% good. I'm not, but I always go by the 80-20 rule because we're human, and also we enjoy having some sugar. So, you know, you do enjoy these things. So I wouldn't say, okay, you know, don't take it all out. I wouldn't say that. However, I will say that essential fats are really, really important. So, like, you know, avocado is a great fat. And people think, oh, I'm going to get fat from eating avocado. I think on a daily basis, probably I would would say 40% of my diet is probably good fats. And then carbohydrates, you do have a little bit, I'll have a biscuit when I come home with my cup of tea, but that's probably where it ends. And then you're having your source of protein. So always think on your plate. And I've always taught all my children, not all my children, I've only got 2, but all my nieces and nephews, I always say, and they're only 4 and 6 years old, and I say, always look at your fist, have you got that much protein on your plate?
Okay.
So as sort of to get them, and now they all do it. So even if you're teaching them, I say, if you haven't had that much protein, you haven't had enough protein. And I want it to try and use a vegetable protein if you can, or if you're going to use meat or fish, but always use it. So when they've got an image, a way of recognizing, then they do follow it. And you can teach that to little children. And then I disregard, and I always also think, if you add things, if you tell somebody, add this to your diet, it is much better in terms of their psychology than to say, I want you to stop eating this, I want you to stop eating this, and I want you to stop eating this. So when I have clients in clinic, I never say, but I always say try and reduce whatever, but I don't say stop eating something, because actually human psychology would say, okay, I want you to add this into your diet, and it's going to be a lot more, you're going to get a lot more what's the word, when somebody, compliance, okay, and you're going to get a lot more compliance with a client than if you tell them to take everything out, because what I've learned is that habits are very, very hard to break. And these habits, we've all grown up with. We've grown up with ideas of what is healthy, as you said, and what isn't healthy. And I think that you need to change people's habits slowly. But hopefully, if you say, add this to your diet, add this to the diet, then the bad things, they're just going to push to the side anyway, because they won't actually, hopefully they'll be full by the time after they've had all your good stuff, and they won't need all of that bad stuff. And then when the compliance comes, when they see improvements themselves, and it only takes a few different things to do, and you will find improvement in your health. I don't know what you would think.
Can I just jump in there, Mike? There were so many great things in there.
Sorry.
I know I'd say, I'll just let you carry on. So, first one that I wanted just to pull out was the 80-20 rule. Okay,
Yeah.
What Rosie's talking about there is 80% of your diet is kind of good, healthy, clean food, and the 20% is that bit where you allow yourself to kind of have other things. So, if you were to divide that across the week, let's say how many, so we got 7 days, if you eat 3 meals a day, so what's that, 21 meals. So if 80% of 21 they're all good, clean, healthy food, then you've got 20% where you allow yourself that freedom. And maybe if you feel like you want to get a bit more strict, maybe you could increase that to 90% and maybe 10%. So that's the first one I wanted to pick out. Secondly, so you touched on, in terms of portion size, protein. Okay, so as a good guide, Rosey said a fist-sized portion of protein for a meal. Would that be the same for men and women, or?
Yeah. So it's just sort of like it's a guide for yourself, isn't it? Really. So obviously, we use it with the children to say, like, have you had enough protein? So just put your hand on top and say, are you having enough?
Great.
Because what you've got to remember about protein as well, you might think, right, I've had 50 grams of protein. That doesn't mean you've absorbed 50 grams of protein. Okay, so different proteins, absorbency rate is different. So with red meat, it is the highest absorbency, and then with white meat, it's slightly less, and then with vegetable proteins, it's even less. So you've got to think, you might be, as a vegetarian, you might have some lentils or some pulses, but you're not going to be absorbing all of that protein. So I think as the fist size is really, really important. And and we don't, I wouldn't say, right, okay, go out and eat lots of red meat because you need your protein, because obviously that has its own health benefits and health negatives, and you have to do everything within within reason. However, go for the fish protein, go for more fish, go for oily fish, so you're having your good fats, and you're having your protein. So go for your 3, try and go for the smash fish, and I don't know if you use your smash as a acronym. So that is sardines, mackerel, anchovies, salmon, and herring.
So say that again.
So smash fish are sardines, mackerel, anchovies, salmon, and herring.
Oh,
so if you
good.
remember that acronym SMASH, and you think, right, I need to have 3 portions of those fish, and I know some people don't like any of them, but there are different ways that you can eat them. Like, I managed to get fish down my children, and they're very fussy, as all children are, but if you disguise it, it's quite easily done. So I can send recipes in terms of that, and I can help you all out there if you want certain recipes.
Perfect.
Yeah.
So just coming back again to that, Michael, could you just tell us good fats? Just so we've had avocados, maybe just a little bit more about other examples of good fats, and we also touched on proteins. Why is it important to have protein? And proteins are broken up down to an amino acids. Where do we get that from? Can we get them all from certain things? If we're a vegetarian, does that mean? Can you just explain a little bit about that?
Yeah, actually, the good fats, she talk about avocados and also things like almonds. Some of these raw nuts are very, very good essential oils. Salmon also got some oil there. Walnuts has very good oils there. Yeah, so a couple of some of the nuts are also very, very healthy. They are very rich in that, and I personally love the avocado myself a lot. I use it almost every time. Olive oil is a good oil, very good oil.
So
Coconut oil.
Quickly, so do I just pour the olive oil on, or can I cook with it, or what do I do?
The best way to use olive oil, is not to heat it, because once you heat it, even though it's good,
so you just pour it on top.
Just use it as on your salad as a dressing. That's the best. If you want to, I'll recommend people to use coconut oil rather to cook.
Coconut oil.
The vegetable oil, and I will really, even though we are talking about fat, but vegetable oils are not good because of the way it have been processed. It has high levels of trans fats that may cause high levels of inflammation in your body. So I'll rather prefer people to use this essential oil, coconut oil, olive oils, and that kind of stuff. If you want to cook, please use coconot oil.
Would you use avocado oil as well? Would you?
Yes, that's also very, very good oil.
Avocado oil.
It's excellent because you can use it. You can cook it at a very high temperature without it being spoiled. And do you use butter? Do you like
butter in moderation? In moderation.
Okay.
In moderation. The issue about fat is when you subject the heart to high temperatures, you change the molecular structure, and that becomes harmful. So we just want to encourage people to use fat wisely, not to put fat under the microwave. That's another story.
Okay.
Because the radiation that causes a lot of damage to the molecular structure of the fat, and that can become really toxic.
Just generally avoid microwaves.
Exactly.
So if I need to cook, then what should I cook with? If I let's say, should I fry or should I not fry? And if I do fry, how should I do it? I know, and in fact, and if we could just come back to protein after that as well,
So frying, like we said, I think the main oil I would use is avocado oil or coconut oil, and coconut oil is very good because it's solid at room temperature, so you know that it's not going to become carcinogenic when you heat it. If an oil smokes when you heat it, that's a bad sign. Okay, and if you look at avocado oil, if you ever use coconut oil, they don't smoke when you heat them, so that's a way to tell whether an oil is as good. I do use butter. It's my little guilty pleasure, I would say. And I do enjoy eating butter, and sometimes I also cook with lard. Okay, I don't know what you would feel about that, Michael, but I do use lard sometimes in my cooking. And in terms of salads, I always use extra virgin olive oil, and that's probably the only oils that I would use. I might use sesame seed oil if we're doing sort of Chinese cooking, but that is a very, very small amount. And the other thing I was just going to say about fats is seeds. There is a really great there's a great recipe where you could just, and it's not a recipe, sorry, it's just really you have to grind all the seeds, but you do flax seed, you do pumpkin seed, sesame seed, and sunflower seed. And what I do is I grind it all, I put it in an airtight container, it's in the fridge, and then if the children are having cereal, which does happen, and I just say, right, okay, put a spoon of seeds in, because then they're getting a little bit of protein in their breakfast, and it's going to keep them fuller for longer.
Yeah,
Whereas
it's
if
good.
they just have empty carbs, which is what all cereals are, unfortunately, but you know,
Sneak it in there.
you just sneak it in there and say, right, you know, you put a tablespoon in and you force them to have it. So, right? Okay,
Clever.
but they mix it in and you can't really tell. Whereas, and the other thing about seeds is that you must make sure that you ground them, because when you look at seeds, they're coated and they're quite shiny, and that's an indication that we can't actually digest them if you have them whole. So that's why it's really important to grind your seeds for the absorbability of those.
Okay. So you can't just chew it, you have to grind it.
You can chew it, but how many times can you chew a little flaxseed? You know, you would just digest it. You would just take it in, and you know, you won't actually, you won't chew it. Okay. How many? So, and flaxseed is a great example of that, because if you look at the coating, it's so shiny, and we don't have the ability to break that down in our stomach, so it will just go out, and you'll be used like as a mode of like fibre for clearance. So, so if you are using them for their protein and for their good fats, then it's always important to actually grind those seeds. But you can if you do a big sort of kiln the jar, that will last you a month. If you make the effort to do that, and it takes you half an hour, not even half an hour.
Perfect. Oh, brilliant. All right, so we need some nuts and seeds, and we need to grind them. Good. So Michael, just coming back to protein then, what is that, and you know, what are amino acids, and just tell us a little bit about that.
Yeah, protein is what. I'll put it this way: protein actually gives us helps to build our muscles and stuff like that, and it breaks down into its smallest units called the amino acids. So protein breaks down into amino acids, just like sugar, carbohydrate breaks down into glucose. Protein breaks down into its smaller units as amino acids, and that is very, very important for enzymatic activity, you know, muscles and all sort of stuff. Yeah. Now, when people come to me especially with what to eat, you know, I look at them from another angle. I look at them from based on their body mass index, because some people have got high BMI, which obviously also tells on their insulin resistance level. So I advise them based on that, because if you come in and you have a bit of weight, then I have to help you to select food, your diet in a way that will help to reduce the amount of insulin that you've been released in your system. So normally encourage them to take more fat, so the fat content in the food is a bit high, and then protein, then carb is a bit very, very small. Or sometimes I tell them that for this time, cut out carb as much as possible if they have high levels of insulin or insulin resistance, or they are carbohydrate intolerant. Most of the time, people who have big weight, they are carbohydrate intolerant. Therefore, I don't encourage them to take more carbs. I rather encourage them to take more fats and protein, and that will help you to reduce your insulin level. So that's the kind of combination I give normally.
I heard it said once that if you have as like an illustration, you have like a cup-sized portion, or not a cup, a cupped hand-sized portion of carbohydrates if you're having any at all. So that's a good kind of guide. You know, we got a fist, and in fact, if any of you guys get a chance to check out Precision Nutrition, they've got some great kind of illustrations on that. We'll try and put that as a link on the notes. But they say, like Rosey was saying, like a fist-sized portion of protein, and then a cupped hand-sized portion of carbohydrates, or if possible just minimize them as much as you can. I know that's something that I've been doing for a long time, because it's just our body doesn't need it.
Just to add a bit to that, you know, if you look at the 3 macronutrients that we have: carbohydrates, proteins, and fats, they all respond to the hormone insulin differently. Carbohydrate cause high spike in insulin release, then followed by protein, then fat is the least. So based on that reality, we advise people that protein and fats, if you really want to control your weight or live a healthy life, it's always good to increase your fat intake and protein rather than carbohydrates. So I always have that philosophy when people come to me. I look at them, interview them to find what they're eating, and then based on what they tell me, advise them based on this reality.
Michael, can I ask you a question? Have you advised anyone to do sort of intermittent fasting with in terms of controlling diabetes?
Wow, I have.
Okay.
It's a brilliant concept to actually apply the principle of intermittent fasting especially if you want to help people to manage their diabetes or even weight. The advantage behind
Can I just so intermittent fasting, just to clarify, so what is that, and give me some examples of that?
So intermittent fasting is you eat within a small window within the day. So like, for example, when I do intermittent fasting, I will eat within a 6-hour window. So I will miss breakfast, and I will eat at 1 o'clock, and I will have my second meal before 6, and then I'm done for the day. And then I'll just drink like herbal tea or drink water. If you can have coffee if you would like black coffee or black tea, but no food source in that. In the beginning it is difficult. Like I won't lie, when I first started, I was a regular breakfast eater, and I used to get a headache if I didn't eat. But slowly I extended the timing, and I feel really, really good when I'm using intermittent fasting. And you find that you do not overeat, because you realize how much actually extra food that you're eating that your body doesn't need, because your energy levels will not slump, and you think that they will. So you do not get the energy slumps that you will when you are feeding your body, because every time you feed your body is then producing insulin, and because of that, then you're getting the sugar spikes in the day. So it manages to control all of that, and you do miss a meal, okay, but in that time when I'm eating, then I eat 2 good size meals, but it's worth trying, and I know it's very effective in managing diabetes and managing weight. And
great. So perfect. So one example is, like you said, to miss breakfast. I know other ways you can fast. Maybe you take like a 10-hour or a 12-hour or 16-hour or 20-hour. Well, I don't know if 20, but kind of 18 hours. So you choose how long the fast is, and then obviously you're intermittently eating. And so what's the benefit for that, Michael? What would you say?
The benefit in applying intermittent fasting is the fact that, you see, anytime we eat, we actually compel the body to release insulin. That's automatic. And high spikes in insulin may trigger all sort of metabolic issues, because diabetes, all these other complications, all those things, metabolic syndrome, which is you can have fatty liver, you can have high blood pressure. I mean, all those things that goes on with that. So what we are trying to avoid in using intermittent fasting is to help to control the high spikes of insulin, which can lead to so many issues, for you, because once you are not consuming food, what you are doing is that you are asking the body to go into the fat storage to burn the fat. It's better to burn fat than to burn glucose. If you burn fat, our body storage, 95% of our energy storage is fat, and about 5% or so is 5% is about glucose. So if you burn more glucose, it's not good. It's better to burn fat than to burn glucose. So during intermittent fasting, there's no insulin spike, because as long as insulin is there, it shuts off the fat burning mechanism, because insulin is a fat storage hormone. So once insulin is in the blood, it closes the door for fat metabolism. So once you have intermittent fasting, at that level, insulin level is virtually nil. And therefore, you are not able to allow the body to go into the storage to burn fat. And when you are burning fat, you don't lose energy. It does so much to the body. So that is the reason why we apply intermittent fasting, to allow you to have high spikes of insulin, and therefore able to help you to burn the stored fat in your system.
I think for the average person, though, I think just even using a 12-hour window would be a start. So it's eating between 7 and 7. That's a start.
Okay,
Like, if you're not doing it as seriously as some people, we would say eat within a 6-hour window or an 8-hour window. But for the average person, they should be able to do that much. I think eat within a 12-hour window. That's a start.
So I'm guessing that's then why people suggest not to eat in the evenings, so that then naturally you're intermittently fasting. If say you have dinner at 6 and then you don't have breakfast till 7 or 8, then essentially breakfast. You're breaking the fast.
Beautiful.
Yeah. So by fasting we are burning more fat. So like we were saying, like Rosey and Michael were saying, that by using some intermittent fasting, if our goal is we do want to lose fat, and not everybody is obviously, but if your goal is fat loss, then maybe that's something that we can try, or that you could try, trying out just to extend those periods, but then getting a good quality, good size meal when you are eating it, okay, which I'm sure will probably be hard at first, but then as you get used to it, your body will start to burn those fat stores. Great. Brilliant. So just before we finish, I've got a couple of interesting questions for you. Just quick, kind of rapid fire questions. So, so great. We've spoken about a lot there. Thank you. We've spoken about fats. We've spoken about proteins. We've spoken about metabolism. So just to wrap it up, my question is, if I gave you an island and I said on that island you could have anything you like, any animal or plant, but you could only choose 5, what 5 would you choose?
I would choose I would take animals or plants, anything. So definitely salmon, definitely coriander, definitely garlic, definitely onions, and definitely some chili powder.
Wow, good. All right, Michael, I know that's a tough question. I'm putting you on the spot here, but what would you choose?
Avocado would be and I would take my almonds, walnuts, and then I would take my coconut milk.
Good. No animals?
Oh, sorry, animals.
just having salmon.
Yes, that's right. I will take.
I'll share.
I will take animal. I will take my salmon, the fish.
Yeah. Sure.
Yeah.
Oh, excellent. All right, brilliant. Well, great. So some good kind of like foods that I think that we could all can do with eating a little bit more of. So just to finish off, have you guys got any parting kind of thoughts or anything you'd like to add, or anything that you kind of thought, oh, that'd be good that I didn't get a chance to say that? Is there anything else that you'd like to add?
I think I'd just like to add, or I would just say that, as an individual, I think for other people, I want to help people and inspire them to be healthy and to empower them with the education and the knowledge to make that difference for themselves. And then also because I believe it's a catalyst, so once one person does it, that then triggers off them to tell 10 other people, and then they become healthy as well. And I think that we all need to have a healthy mind, a healthy body, and healthy social interactions as well with people around us. So and that's going back to functional medicine is the heart of functional medicine.
Great. Michael, is there anything you'd like to finish off? Or?
Yeah, I want to suggest to the listeners that health is just one, and we all need to, take responsibility. It's not about waiting for a doctor to fix your health. I think we need to own up for our health and say that I want to gain control. What I mean by that is that I want us to encourage ourselves to ensure that we are treating this body with respect and dignity, and not just put anything in the mouth. Normally people buy cars and they want to make sure that they put the right fuel, they clean it every time, and they take it to MOT, making sure that they follow the rules, compulsory by conscience. But when it comes to the health, it's not like that at all. And I want to help people to change that kind of mentality, that your body is more important than anything, and therefore we need to give the body much attention. Watch what you are eating. Don't just put anything in your mouth because it's tasty. Anytime you are putting anything in your body, ask yourself, is it going to make an impact in my health? Because there's something called nutrigenomics. What you consume may trigger a gene to initiate a disease or protect you against a disease.
Wow, that's
and I
serious.
just like to add that, there's a quote, and I can't remember the nutritionist who said it, but basically it said that every time you put something in your mouth, you're either harming your body or healing it, and that's what you've got to think. Am I harming or am I healing?
Good. Wow, perfect. Thank you. That was great. Thank you so much for coming in, Michael, Rosie.
Thank you.
I hope you've all enjoyed that. There's so much to take in, and I think maybe make sure you go back and listen to it again and get as much as you can out of that, because Michael and Rosie are specialists in their field, so there's lots of good information there. Okay, thanks a lot everybody for listening. I hope you enjoyed it, and until next time, see you soon. Bye.
Bye.
Bye.